Welcome to Speech Scope, a MedBridge podcast where we conquer challenging topics for the medical SLP. Our aim is to deliver actionable takeaways for clinicians like you through captivating discussions with experts in our field. To receive continuing education credit for this episode and access bonus resources, make sure to check out medbridge.com. Hello, I'm your host, Sarah Baar, a clinical SLP in Michigan with over 15 years of experience. I specialize in adult neurogenic disorders and the life participation approach. Today, I'm excited to be joined by Dr. Samantha McDaniel, an expert in the area of the clock drawing test. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome, Sam. Can you get us started by telling me a little bit more about yourself?
Sure. Hi, Sarah. Thank you so much for having me. It's very exciting to be here and talk about the clock drawing test. I'm currently an assistant professor and graduate director for the Communication Sciences and Disorders program at Georgia Southern University in Savannah, Georgia. I've been a speech language pathologist for about 18 years. My specialty area is in adult neurogenic communication disorders, and I absolutely love supervising students, but I really also appreciate interdisciplinary collaboration.
Sam, I'm so happy that you are talking with us today and that you have a very specific interest, which is the clock drawing test. I can't wait to hear about how you even got interested in this test. So why don't you tell us a little bit more about your clinical or professional experience and what made you get interested in the clock drawing test?
Yes. Why am I obsessed with it?
Yes.
Yeah. So I learned about the clock drawing test in graduate school at Rush University. Dr. Richard Peach taught me about it. He's an aphasiologist, but also taught our cognitive communication class. And it just fascinated me because it's such a quick and easy test, and you can tell so much information. And I don't think that we have another test like that out there that gives us so much information in just, 2, 3, 5 minutes, right?
Right.
I've used it then for the last 20 years in various settings, in acute care and acute and subacute rehab and outpatient settings. But more recently, when I've been giving it, especially to my younger adults, I've noticed that they've been struggling to pass it. And they've also gotten normal scores on other cognitive tests. And I've also been getting comments from my patients or, their parents or family, just like, I wouldn't have been able to draw this beforehand, or they don't know what a clock is. So that just kind of got me thinking about what it meant for the accuracy of the clock drawing test for this young adult population. And then that kind of led me to the research side of things and how I got started with research. And I have always been a little scared of research. It's just been something that I have not wanted to do. I've known that I've not wanted to be a researcher, which is crazy that I'm doing it now, but
right.
Right.
You are a researcher, right? Yeah.
I am. I know.
I love it.
I'll get there. So I didn't want to do it. I'm glad that other people did it out there, but you just don't get as much education in graduate school specifically on there. There's a course, but not as much. And so it was more unfamiliar and scary, and I didn't want to do it. But you get a few years out from grad school and it becomes necessary. You have to stay up to date if you want to do the most evidence-based practice for your patients. And so then I had to do it. And then just supervising my students, they had really insightful questions and I didn't have the answers to them. So I had to look them up, right?
Yeah.
And I was still curious about the validity of that clock drawing test in young adults. And no one else, at least researchers, seemed to be finding the answers for that. And so I just had to find them myself. So that's what led me to research. It's no longer scary. And as I'm teaching my students, my graduate students and undergraduate students, I want them to have the most up-to-date knowledge, and I want them not to be scared of research too. So that's kind of what led me to this.
I love that. And I love that you took something that, a lot of times we hear our clients or family members saying like, oh, I could never do this before. And maybe
Mm-hmm.
it might be easy to just blow that off. But I love
Mm-hmm.
that you kind of leaned into that and really started doing some important research. So
Yes.
just like thinking then about this test, what questions do you think that we need to be asking ourselves as clinicians or like maybe questioning about the clock drawing test? I'd love to hear your thoughts on that.
Yeah. I think it's always important to be asking yourself questions about evaluations and treatments that you're providing to your patients. Clinicians know the real problems that are happening in practice, right? Because
Yeah.
they're living it, right? We're seeing those patients, and that gap between clinician and researcher is a real thing, especially if each one of those clinician and researcher have only played one role or the other.
Mm.
So we need to keep those lines of communication open so that the really important problems are being researched and that the really important research is being implemented into practice. And I'm not saying that every clinician should be a researcher or vice versa, right? That's just kind of like where my profession led me, but
Yeah.
it's not for everybody. But I get it. Like, it's scary. It's scary to research, reaching out to researchers and starting those connections. So, but I really think it's important. So,
It is.
yeah, definitely.
Especially, I love that you have such a big clinical background. I mean, that
Yeah.
really is like provides like
Yeah.
a rich background for doing research that's going to make a real solution for clinical SLPs.
Absolutely. I mean, I have stored up so many clock drawing tests from patients of mine previously that I felt like, what am I going to do with these? I need to
So
do research or something.
you have your clock drawing kind of wall of fame.
Yeah. Yes, sort of. I've made different things. Like, I've even made a pillow out of my patients' clock drawings before. So yeah, I told you I was a little obsessed about it.
Wow, that is awesome. There might be a future side business in there somewhere. I don't know.
Right, right. Yeah.
The clock drawing pillowcases shop, maybe. I don't know.
Right, right. We'll see how many people want to buy that. It's probably just me. About the clock drawing test, something that's unique about it is that any healthcare practitioner can administer and score it, and that there's accurate discrimination for trained and untrained raters. So, which means that like nurses, doctors, PTs, anybody can use the clock drawing test. Us SLPs, OTs have a little bit greater knowledge of cognition and cognitive communication, and we really should use that to get as much out of the clock drawing test as we can and not just say, there's a pass or there's a fail. The clock drawing test tests so many different things: selective and sustained attention, verbal working memory, visual memory, reconstruction, visual spatial skills, executive function. Some aspects of that executive function are abstraction, complex motor sequencing, response inhibition, frustration tolerance, numerical knowledge and language, including auditory comprehension. But even though it tests all those different things, we have to keep in mind that it's just a screening tool. And so meaning that like you should not make a diagnosis solely from completing this clock drawing test. If there are concerns, if somebody, quote, fails it, more testing needs to take place to see what's going on.
Mm. Yeah, so just like listening to all the different things that we could comment on based on the clock drawing test, I really think even though this is a test that a lot of different healthcare practitioners use, like they wouldn't all comment on the same things that we would comment on, right? So that's
Absolutely.
where we can kind of use our specialized SLP skills and learn more about the client's cognitive and communication status
Right.
through the test, but it's not like a test that's like, I did this once and now I can give you a complete diagnosis.
Absolutely. Yep. Totally.
Okay, cool. So now I'd like to shift into, thanks so much for the background info, how you got interested in this task, kind of like why we're talking about it. So I'd love to hear the next steps you took. So what was your own research on this topic? What did you find? What were the takeaways, etc.?
Sure. Yeah. Well, the clock drawing test is really well researched. So it was a labor of love reviewing all the literature. Took quite a while. But some of the things that I found just in doing that literature review is that this clock drawing test is very psychometrically sound, meaning that it has a high rate of passing those who don't have issues and failing those who do. It also has the highest sensitivity and specificity of detecting dementia compared to other brief screening tools like the wire cube and overlapping infinity loops. It's the second most frequently used cognitive screening measure. So people listening out there probably are familiar with it, right?
Mm-hmm.
Also, if you think about it, success for it relies on exposure to an analog clock, right? So we cannot expect someone to draw a thingamabob if they haven't seen a thingamabob, right? Or if they don't know about a thingamabob, which is kind of where we get to with the young adult population. So there's also predictive abilities for recovery from clock drawing test drawings. So if someone fails the clock drawing test, that might mean that they have a longer stay in the hospital than someone who passes. I know, interesting, right?
That is interesting.
There's also no standardized approach to administration or scoring of the clock drawing test. So it can include copying an analog clock, filling in an analog clock from a pre-drawn circle, reading an analog clock time, free drawing an analog clock, including numbers and clock hands. There's also a digital version of the clock drawing test. It consists of a digital pen that patients use to draw the clock, and that pen records qualitative data such as geometric, spatial, temporal properties of the patient's movements. So instead of just scoring like the end result like we would. So those out there, we're probably doing all different administration and scoring of the clock drawing test. There's actually 19 to 20 different clock drawing test scoring systems out there, and new ones are still coming out. So it can be as few as like 3 points, like on the Montreal Cognitive Assessment or the MOCA, or as many as 30 points, like the 30-point clock face test. Sarah, can you guess which one has the best or most accurate results?
Oh my goodness. Well, I've never seen a 30-point one. I'm gonna just say the lower score is the best, just to guess randomly.
Well, that's very true. So basically what they found is that they're all going to give you the same information in the end.
Oh, wow.
So doing a easier one with, less points associated with it is
just as good.
Right. So don't waste your time doing a 30-point assessment when 3 will suffice is the end result of that.
Honestly,
but it's in a lot of different. Yeah, right. I know. Yeah. It's in a lot of different assessments too. So it can just be like a standalone test that you can do just to do, see how cognition is quickly. But you all have probably seen it in, the CLQT, the Cognitive Linguistic Quick Test, the mini cog, the MOCA, like I said before. For you OTs out there, the SLUMS, the SAGE. I don't know if you've seen it anywhere else, Sarah, but it's been in a lot of things. So
yeah.
That was.
Do you, off the top of your head, do you know like how long the clock drawing test has been used? Like how long has this been in since the start of speech pathology? It feels like it.
Right. So it was actually 1915 by Sir Henry Head. So yes, I do know because
I love that you know that. Okay.
I know. He was a British neurologist. And do you know why he invented it? Like to test what specifically?
I would love to know.
It was for aphasia initially.
Whoa. That is so funny because, we don't use that for aphasia.
No. I mean, we can get some auditory comprehension information from it now, but it's not a primarily language assessment. So I found that interesting.
Oh, super interesting. And that practically is at the beginning. I mean, I think that's pretty much at the beginning of our field. So that's awesome.
Right. So like over 100 years ago. So It's no wonder why we're having like questions about it now. It's one of the longest running like still used tests out there, medical tests out there. So that, led me to, okay, I need to do some research here with young adults, and there's not a lot of research out there with young adults. And so what I found personally with my own research was that 25% of young adults cannot pass the clock drawing test, which is insane,
Young,
right?
like just kind of no neuro diagnosis, just like
Correct.
healthy young adults, 25% can't do a clock drawing. Okay, that is
hmm
crazy.
I know.
Kind of
And
want to try it
I,
with the grad students and see if they could
right.
pass.
Okay, so yes, exactly. That's another concern that I wanted to bring up too is these young healthcare professionals who are young adults, right? Who are going into PT or OT or, becoming a doctor, whatever. Are,
Mhm.
are we expecting them to administer and score the clock drawing test for older adults when they can't even draw one themselves? Right. So that's
Wow.
kind of a whole other leg of research that I need to get into, but it's interesting.
So interesting. Tell me more
Mhm.
about what you noticed in your research then with
Yeah.
that study.
So, young adults, I termed them between 18 and 30 years old. There's not really like an official, age limit there. So just as I'm talking to give you an idea, but the issue when that 25% could not pass, was mainly with clock hand placement. So their visual spatial skills and their number writing and placement were relatively intact, but they could not place the clock hands
Hmm.
even if they knew the correct time. I had one participant who wrote the correct digital time, but then placed the clock hands incorrectly, which I found just fascinating.
Mhm. That really is.
Yeah, yeah. I also found that only 9% of young adults wear an analog watch. So that goes to like use and exposure and, could possibly be a reason for not being able to draw one. And then I went into the clinical setting and looked at young adults versus older adults with various levels of cognition and kind of compared them together. And I did notice that there is a difference in clock drawing test performance between the young and older adults. And then
So those
specifically,
are specifically like people who have some type of neuro diagnosis, and you kind of just confirmed like, yep, there's a difference here too.
right. So this was retrospective chart review looking at a hospital and acute care setting. So some of these individuals had normal cognition. Some, had rated mild, moderate, and severe. But overall, comparing all of those together between young and older, there was a difference in
Mm.
how they could draw a clock. So, it's one thing to kind of see out on the street, can 18 to 30-year-olds draw a clock, but that's not where we see patients, right? We see
Right.
patients in the hospital, in the clinic, after they've had a car accident, all those types of things. And so I had to, really see like, is this a real problem where we are actually seeing patients too?
Oh, I love that. What a cool design.
Yeah. And then I went one step further and looked at a couple different diagnoses. And the one that was a little bit different was a concussion or mild traumatic brain injury, where young adults with the diagnosis of concussion had higher cognitive severity rating scores when the clock drawing test portion was removed from the cognitive screening. So, kind of telling us like we're doing a disservice to these young adults by adding this measure in and using those particular scores. So, we
Mm.
can, and I'll talk about it, when in a little bit, but um, that's, we want to use those what we gather from it and not particularly the scores.
Mm. That's so interesting. Okay, so I think let's just move right in then to our actual clinical practice and like how we can translate your research
Yeah.
into the clinic. So I have been thinking a little bit about the clock drawing test in preparation and just like thinking about how I've used it clinically and how other people use it. And so kind of the first thing that came to mind is just how this test is embedded within screeners or tests like the ones you mentioned, like the MOCA, the slums. And so, and, even other healthcare professionals are using this. So how does your research affect like using this or interpreting the clock drawing test like within these screeners or other tests?
Yeah. So the first thing is that I don't think we need to change our practice for older adults. There's extensive research with older adults. It's mainly focused on screening for dementia, and everything looks good there. So let's just continue our practice for older adults. Now, with younger adults, I do think that we have to use some caution. And so changing some things up, we could do a completely different screener and just avoid the clock drawing test. So that's an option. We could use additional tests. So we could use the clock drawing test, but then also use a different cognitive screener or cognitive assessment to kind of supplement and validate our clock drawing test scores. Or I think we could also add some points on if the person is incorrectly placing those clock hands. I think we could add a point. So, for example, on the MOCA, like you mentioned, it's a 3-point system for the clock drawing test. The first one is circle contour, the second one is number placement, and the third one is the clock hand placement. So if a young adult, like I found, is doing, the circle correctly and the numbers correctly, but just the clock hands are off, if you have a patient who's a young adult and doesn't correctly put the clock hands on, we could add a point, right? Yeah. And so that kind of gives us an out for, is this really valid for the young adult population?
That makes complete sense. And it reminds me of like the MOCA, the Montreal Cognitive Assessment. They have an option to add a point, I think, for people with maybe 12th grade or lower education level. So to me, this would be like another way to like account for some of those differences between who you're giving the test to.
Absolutely.
Great idea. Yeah.
And then just as I mentioned before, I think another thing that we have to think about in the clinical setting is that we need to be training our young adult healthcare workers to interpret these clock drawing test results. So in higher education, those professors who are teaching nurses and SLPs and OTs and all the healthcare professionals really just have to focus on and not assume that these young adults just know how to draw and interpret analog clocks.
Right. They might be in the 25% there who wouldn't pass that.
Absolutely. Yeah.
Okay. So kind of moving on to like another clinical focus. So another way we as SLPs use the clock drawing test is just really gleaning all that information that you were talking about. So we might be able to comment on their attention or executive function skills, visual spatial skills, auditory comprehension, presence of perseveration, all of that stuff. So do you feel like any of your research like shifted like what we might comment on for the individual?
Yeah. Absolutely. So thinking about those young adults and not having as much exposure or use of an analog clock, something like visual memory, they're not going to have of an analog clock, right? If they don't have use and exposure of it, they're not going to remember it. And so that's something that we can't say for certain that these young adults, are having difficulty with visual memory, right? And we might normally say that auditory comprehension and working memory or attention are impaired if the person incorrectly places the clock hands. But we can't say that with certainty for young adults anymore. So I think it's important to recognize that. And when we are, like you say, kind of expanding not just pass or fail, but talking about those aspects of cognition, I think it's important to recognize that.
Good. So the next question is the burning question. Okay, so if we are maybe having a little nuance, especially and really for the young adult population, what do you think is going to replace or go alongside the clock drawing test? So, in other words, if we maybe shouldn't use that all the time with young adults, then what might come along next?
Yeah, you're right. It's the burning question. This is the question that I get asked the most when I start talking about this. I have several ideas, but I think in general, it needs to replicate all of the properties that the clock drawing test has. So it needs to be psychometrically sound. It needs to test many areas of cognition.
Mhm.
Um, it needs to be easy to administer, non offensive, non invasive. It also needs to withstand the test of time, right? So that we can continue to use it for decades to come. I mean, we've used the clock drawing test now for over 100 years. It would be nice to use the next thing that we do for another 100 years or more so that we don't keep reinventing the wheel.
Yes. I actually saw a social media discussion about this topic
Really?
just in the last week. And so
Oh my
people were
gosh.
throwing out some ideas of like, well, what else? What's going to be next? And so, here are a couple things that people threw out: sequencing a TikTok dance, drawing the keypad on an iPhone. But
Mhm.
what I'm hearing is, you know what? I don't think those things are going to stand the test of
Right.
time. So we
Right.
need to keep searching here.
I think it needs to be something primal, something that humans have done from, the beginning of time.
Yeah.
That technology is not going to change that we do. So, yeah, I have some ideas. That's like my ultimate goal. And when I first started researching, I was like, you know what I'm going to do? I'm going to find the next clock drawing
Oh,
test. But I I don't think I understood research because you have to actually first discover that there's a problem with it, then you have to determine why there's a problem. There's just all these
yep,
steps. And so I'm in the middle of that right
yep,
now. Maybe before I die, I'll see the
yep.
next clock drawing test. I'm hoping. We'll see.
Okay, well, we are all rooting you on, and
Thank you.
so keep going for it. I can't wait to see what's next.
Thank you.
Um, so because this is a test that's widely used, when we do our clinical work and we use the clock drawing test, I want to think about perspectives of other stakeholders. So maybe like when we're talking to patients, when we're talking to other medical professionals about someone's results on the clock drawing test, knowing that there's some nuance. Do you have any recommendations for talking points or word choices that might just help explain where we are currently at with this task?
Yeah, good point. I think we do need to write some sort of caveat in our assessment documentation or when we're explaining these results to other healthcare professionals that are on the team. Something like, although clock hand placement was incorrect, I do not suspect this is caused by a cognitive impairment or further testing should be completed. Something just saying, in my professional opinion, and then describing it. I mean, we have gotten a lot of education in the area of cognitive communication, and so we are the experts in this area and should be able to describe it.
Yes. Yes. Okay. That's good. So, just to summarize your research and have maximum impact here, let's let's see. Can you tell us three top takeaways or actions for clinicians to keep in mind or put into practice?
Yeah, absolutely. Okay. So I think, and I've said this before, but the first one, the clock drawing test remains an adequate cognitive screening tool for older adults, right? So let's not change that. Two, it can still be useful for younger adults, maybe to monitor change or their progress for intervention purposes. We could look at their visual spatial skills over time, something like that. And then using the clock drawing test to screen for dementia as young adults age is likely going to yield some false positive results, which are then going to give us some unnecessary healthcare costs, can even cause some emotional distress, right? If we're telling somebody, hey, you might have dementia, because they're not able to draw a clock when really they just don't know what an analog clock is, that's going to cause some problems.
Yes. Yes. Okay. Those are great takeaways. And honestly, I love the distinction you made with the young adults that really it's that clock hand placement that people aren't really getting. So if we're looking at, number placement for visual spatial skills, like we can still do that even for young adults. It's just kind of the rest of the task that may be changed.
Yep, certainly.
Okay, that's awesome advice. So let's take that advice or those key points and talk through a couple real world examples or maybe like case scenarios just to bring it to life.
Sure. Okay, so let's say we have a young adult patient, maybe they're 19 and they're fully employed. We'll just give them a job as an EMT, okay? And they came in with a fall off of a bicycle. The brain imaging is negative, but this patient is experiencing some of that negative sequela that comes from a likely concussion or mild traumatic brain injury like nausea, headaches, sensitivity to light and noise, that type of thing. And the physician has ordered an SLP consult for a post-concussion cognitive communication evaluation. So you go in and you complete the Montreal Cognitive Assessment. We've been talking about that one, right? The MoCA.
Yeah, great.
Let's say the patient scores a 25 out of 30, okay?
Yeah.
And on the clock drawing, they scored a 2 out of the 3 points. With the contour and the numbers are correct, but that clock hand placement was incorrect. So we'll just kind of talk through this a little bit.
Yeah.
So first of all, we need to know that the MoCA is only validated for 55 to 85-year-olds. Did you know that?
I did not know that. And I'm like, my chin is down on the table right now because, I have done acute care, inpatient, outpatient, and I'm like, oh yeah, any pretty much 18-year-old plus, I've been given the MoCA to in my different settings. So whoops.
Right. And it's good to know that, right? So we can use some of the information, but it's not validated for, say, this 19-year-old. So that's the first thing that we just need to recognize and bring to the table. And then if they did score a 25 out of that 30 points total, that's considered a mild cognitive impairment as far as the MoCA goes. So if this 19-year-old could not draw an analog clock prior to the accident, they're probably not going to be able to draw an analog clock afterwards either, right? We can't expect them to do something afterwards that they couldn't do beforehand. So if we did add a point on due to his age, he's being a young adult, that would increase his score to a 26, and then that would be within the normal range. So
that's a big difference then. That point really matters.
Difference. Exactly. Yeah. So this is going to change like the course of your actions as a clinician. You'll, probably still follow up for those symptoms and how they're going to affect their communication ability, but you're likely not going to complete more thorough diagnostics for cognitive communication. But this decision could also affect his return to work, right? If his employer might not be as confident in his performance, especially if that medical documentation says something like a mild cognitive impairment, when it's really not, that employer is not going to be as thrilled for that person to return to a job, especially as an EMT and dealing with other people's lives.
Wow. That is a great, it really shows that understanding the latest research like this, it really has real life impact and outcomes for our clients.
Yes.
And to understand the nuance with the different tests that we might be giving.
Right. So
you want to give maybe one other clinical example?
Absolutely. So let's say you have another young adult, we'll just say they're between 18 and 30, and then you've been seeing them for services after a craniotomy. And in your evaluation, you've noticed some visual spatial deficits, just with whatever cognitive assessment you gave, you just kind of noticed that. And so the clock drawing test, if you gave that as well, that could be used here as a baseline to further evaluate the visual spatial skills, and as a repeat measure used to determine that client's progress too. So you could give it, initially during the evaluation, and then 3 months later or whatever as a follow-up to kind of see how those visual spatial skills are coming along, and not really using the pass or fail as a score.
Yep.
Right.
That's great.
Yeah. And I think, you could report the overall score of that clock drawing test, but again, having that with a caveat stating that the validity of that particular client's findings are in question due to the lack of prior analog clock knowledge or something to that effect. But I think we need to be writing some sort of caveat with these patients.
Yeah. I like that, for both this clock drawing test example and then when we were talking about the MoCA, it's only validated for 55 to 85-year-olds. You're not saying just throw everything out, just like you no longer have a tool that you were using, but it's really like, hey, this is important to understand. And we don't have to throw it out, but you have to understand this when you're interpreting results and like maybe even how you're documenting on different things.
Yeah.
And I appreciate that about you because I can tell you've been a clinical SLP because we can't just have the answer be like, this doesn't work, right?
Absolutely. Yeah. That's where, being a clinician as well comes into play here, because I know what's available to you all out there, right? And what you are supposed to be using, what your protocols are for giving a cognitive communication evaluation. And it's, your hands are tied at some point, but so we have to work around some things. And so just being aware of these things and just being a little more attentive is helpful.
Yeah. So I'd like to just ask what, like maybe personally, if you can share, what do you think the next steps are for your own research about this topic, or just like in general? Like, do you kind of have an idea of what might happen with the clock drawing test in the next, I don't know, decade or two?
Yeah, I have a lot of things that I want to happen with it. So we'll see what comes to fruition. But
Yep.
I would love to. So all of the research that I've been doing has been in the United States. And I would love to see if maybe some British English speaking countries, those young adults are having difficulty. I'm just wondering, is it the language that we're using, like 10 after? Is that a concern? I know when I tell my students, my undergrad and graduate students, hey, we'll have a break right now, come back at 1:45. They look at me like I have three heads. They do not know what 1:45 is, or, 10 after, or half past. That's a foreign concept. And so I'm thinking that language is part of the problem, but is that part of the problem just in the US? And so I want to check that out, because that's also going to affect, they practice speech pathology all over the world, and I want to help as many clinicians as I can. So I want to find that out as well. And then I would love to, start evaluating some of my ideas for the new clock drawing test, and see, what I'm able to get from that. What is this actually testing? Is it psychometrically sound? Is it passing those who actually can pass, and vice versa? So I think it's going to take some time. I mean, I'm also teaching and supervising and all the things too.
Yes. It sounds like you have so much free time.
Right. But I do know that there are other researchers out there that are looking into this exact topic. So I've had others, email me, come up to me, and, want to collaborate, want to use my previous data sets. And so that excites me, because other people recognize that this is an issue and are interested in working on it. So I'm hoping it's not going to just be me, and that we can all work together to figure this out.
Oh, wow. That's really exciting and inspiring. And can I ask if there's any clinicians working or listening who've been working clinically, but maybe also have kind of like that problem that's been bugging them, kind of like the clock drawing test stood out to you. What were like the first couple things you did to transition? Like, what made you like switch over to being a researcher now?
Yeah. Well, I had started teaching a bit, and I
Okay.
really liked doing that. And I knew that if I wanted to do that more, I had to get a research degree. So that led me to that and to doing more research. But I would say that you don't have to have your PhD to participate in research. You can reach out to the professors at your local university or whatever, email them from across the country or a different
Yeah.
country, and let them know, like, hey, this is an issue. Can we do something about this? And I think that they would be happy to collaborate on a project. And if you have, someone that has that research degree, they can get the approval from, the IRB to get that research done. And then, you can collaborate. So you don't have to completely quit your day job as a
Yeah.
clinician.
Yeah.
But that's what I'm saying. You all know what the real issues are. And sometimes the researchers don't. And so if you reach out and tell them that, hey, this is a big issue, and you've, looked at some studies and know that it is, send those to them and let them know and ask them if they can collaborate. I think you'd be surprised at the responses you get.
Wonderful. That's great advice. This has been such a lovely conversation. I've learned, and I appreciate you sharing your passion and your expertise. Let us know if you have, clock drawing pillowcases available in the future. To wrap things up, what final words of wisdom or inspiration do you want to leave with the audience?
Well, I think we touched on this a little before, but there should not be one protocol for any patient coming into the hospital or your clinic needing a cognitive screening measure. So, as with any assessment or treatment, it's really important to consider the patient as an individual and to use your vast knowledge and experience to make decisions about that assessment or treatment. Each patient should be evaluated to determine which cognitive screening or assessment's appropriate for their needs, their age, intellect, literacy, tolerance, their physical limitations. This should not be a one-size-fits-all situation. And as healthcare workers, we need to advocate for our patients' needs because we're the experts in this area. And I also just want to say what an honor it is to be able to talk about this topic today. And I hope that other SLPs and other healthcare workers find this information helpful in their practice.
Oh, thank you so much, Samantha McDaniel. We really appreciate you being here and sharing your insight and clinical takeaways related to the use of the clock drawing test.
It's my pleasure.
Thank you for tuning in to this episode of SpeechScope by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, simply log into your MedBridge account and search for this episode to find the accreditation details. SpeechScope also listens to you. If there's a particular clinician that you'd like to hear from, or if you have a clinical question or challenge that you'd like to see addressed on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com.